The Children's Hospital Trust aims to make a difference at Victoria Hospital. However, it needs support to make this happen. This year, the Trust raised over 9 million rand in a bid to boost welfare at that hospital. Now, the outpatient department has limited ventilation and capacity. With the funds raised, a building project to enhance the department will commence at the beginning of next year. To tell us more is the Trust Communications Officer, Ms. Tony Erasmus. Thank you very much for your time this morning. Maybe just paint a picture before we get into the details of the project ahead of the needs of Victoria Hospital and really just where the shortcomings are when it comes to capacity and being able to give children the care they deserve at these health facilities.
Good morning, Rafiwa. Thank you so much for this opportunity. So Victoria Hospital is a sister hospital to the Red Cross War Memorial Children's Hospital. And our vision is to advance pediatric healthcare for the Red Cross Children's Hospital, as well as to strengthen other district hospitals that support and form part of the Red Cross family. And the current need at Victoria, the pediatric outpatient department sees about 7,000 little patients annually. And as you mentioned, the space that the patients are currently in, it's really limited for patients to really move, well. And one of the key things that we see as a problem is also in terms of the sensitivity of, a patient's illness and the privacy that families need. So during counseling sessions, normally a patient would sit next to another patient or a family, or a room would be really, small where more than one patient is normally seen. And we find that normally when it's a case where it's really private and a patient's diagnosis needs to be, disclosed, it's always, an issue where doctors have to go and normally search for a space where people can actually share their diagnosis with dignity, but more so also just a holistic space where every patient has what they need. And patients that are traveling far to get to the hospital as well, having a space where they can play and interact and really enjoy the holistic space of the hospital. So through this development and the growth, we really hope to create an environment where every little one and their families have a space where they can thrive, not only medically, but also enjoy the experience and have access to high quality care.
And you've called on the public to help out when it comes to the fundraising for the building project that is set to take place at the beginning of next year. The target is about 10 million rand. Have there been any kind of support structures created by government or related stakeholders to ensure that you are able to get the necessary resources to make this vision a reality?
Absolutely. I must say from a public perspective, our donors have really opened their hearts to, giving to this project, and just seeing the target that we have set was 10 million rand. And to date, we've raised over 9 million rand. So it's really been incredible to see how the public has supported us and really opened their hearts, especially, coming from the pandemic. They have really been so loyal to give and even supporting us from a government level as well. We've always worked very closely to ensure that we are able to work and collaborate to create the best way to ensure that we advance pediatric healthcare facilities and to strengthen the services of our district hospitals.
Yes, and I was just wondering about that. You're focusing now on Victoria Hospital and the building project that is set to take place next year. But as a trust, on a national scale, do you find that the pediatric services provided in our healthcare facilities, government healthcare facilities, are sufficient for South Africa's little ones?
I think at this stage, one of the key things that we want to ensure is that little ones have what they need and medical staff have what they need. Currently, there are various realistic things that we are struggling with, and the need is very evident in our communities. And what our vision as the Trust is really to support and to look for the needs within our district hospitals in the Western Cape, especially, and to fill the gaps. And one of the gaps that we realized is that many of the patients travel very far to get to, a hospital, especially for subspecialist care and even, medical treatment closer to their homes. And so we really want to create a space where, for instance, with Victoria, that little ones are able to find or to travel close to their homes to a facility, and actually that the facility is adequate enough with all the resources that they need, be it space, medical equipment, treatment, and that even the doctors and the medical team are supported with training and extra support to help everyone, every little one, with what they need to thrive.
One of the big hindrances for parents taking their children to healthcare facilities, and I'm sure you would have seen this in various instances, is the fear of the cost of a child's healthcare, the affordability, which has gotten worse over the last 2 years with the advent of the pandemic and many people losing their jobs or having pay cuts. What do you say to parents that have that concern and the support that you give them in that regard?
Thank you so much. It's actually very exciting because the Children's Hospital Trust has partnered with the Red Cross or War Memorial Children's Hospital Social Works Department, and we've initiated the project called the Family Care Project, and that is really aimed to support the vulnerable patients and their families who cannot afford to travel long distances due to financial resources not being available, and also to support families and little ones who've lost everything during home fires or are hospitalized very far from their homes. And so through the Family Care Project, we are also urging and asking the public to open up their hearts and to donate towards this cause. Just on average, I think a patient that experience of burns treatment normally would come to the hospital for burns dressing, but then the patient would also need to come to the hospital for physiotherapy and other therapy that would aid in their healing. And so normally in a week, one patient would have to travel probably more than three days within that week. And the cost for patients, especially vulnerable patients coming from very low socioeconomic backgrounds, it's quite difficult to travel back and forth to the hospital. And through the Family Care Project, we hope to support the vulnerable families and patients at the hospital through this project.
Right. Let's speak now about the different conditions that children could get and the misconceptions around this, in that it's not just physical ailments like burns, as you've just mentioned, that children may experience. But I mean, over the last 2 years, there's a lot of stress and anxiety and uncertainty that children could develop, also chronic diseases like diabetes. And these are things that parents and guardians should be aware of. And of course, facilities like the one you'll be creating will be able to cater for the children.
Absolutely. And I think also through the Family Care Project, patients, one of the areas that we do support is also food parcels, especially to provide families with the basic needs, especially when a patient is diagnosed with diabetes, having to adapt to a different eating dietary requirements. That is quite difficult for someone and a family coming from low socioeconomic issues, not being able to really adapt to that instant change of their diagnosis. And then we also have another project where, part of our project is also the therapeutic playground, which we also are fundraising for. And we also see that through the burns, as I mentioned, the patient with burns not only goes through, the medical aspect of physically having to be in hospital to take care of the burns, but also the trauma that a patient experienced and the family experience. And so through counseling, through therapeutic play, they are also to not only heal physically, but also holistically being taken care of, in that environment where the family is counseled, where they are seen to, and also where they can actually heal not through a stressful environment, but through therapeutic play. And the therapeutic playground is also one of our projects that we aim to raise funds for.
I want to draw you in on a very contentious topic now, Tony, and it's something that has marred the country's health system for a number of years now. The amount of refugees or asylum seekers that come and seek healthcare facilities or support in South Africa, and the contention that they use it more than a South African citizen would. How do you navigate that particular argument? And is there any prioritization of a South African citizen child over anyone else from the rest of the continent who may be seeking help? How do you all navigate this particular very sensitive topic?
Our vision for the Children's Hospital Trust is to assist all children. The hospital and the Western Cape department has its own system that they use based on the need and urgency of the patient. But our vision for the trust is to really serve all children and to give all children access to high quality healthcare. And we are, we pride ourselves to allow and to work towards ensuring that every child have what they has access to high quality healthcare. So I can't really comment on that at this moment, but I do trust that our vision will really aid and assist all patients that are attending the Red Cross War Memorial Children's Hospital and any other district hospital that we support.
A final thought from you, Tony. I mean, I might be running way ahead of myself here, but there is this project that you'll be breaking ground on early next year. Are you partnering with any other districts around the country to create similar projects of this nature in the medium to the long term?
It definitely forms part of our vision to look at how we can assist other pediatric facilities within the Western Cape. And currently, Victoria Hospital has been our focus, and it will be commencing next year, January. And through next year, we are also looking at various other projects that has not been confirmed as yet, but it is definitely part of our vision to help expand and also strengthen the other services within the Western Cape.
Thank you very much for your time this morning. That is Children's Hospital Trust Communications Officer Tony Erasmus there, talking us through an important project that they'll be embarking on in January next year, as you've just heard, building a facility that will cater to the needs of little citizens across the Western Cape, or in that particular district. And of course, just over 9 million rand has been raised for this project, and the target is 10 million rand. So for those who have contributed, many thanks from the Trust as well as the rest of us, but there's also an opportunity for many more to contribute to the cause.